love to run. I actually love to do triathlons. I love to swim. I love to bike because every one of those things builds a new pattern into the body, and blended together, they make a beautiful, well-rounded pattern. But today we're going to talk about the pattern that running builds into your body. And I'm going to give you what I consider to be the best running recovery. Now, when you are running, it is a quad dominant exercise, which means, so the quads attach here to the front of the pelvis, and especially if you are really focusing on using your toes, it's a super quad dominant exercise. So when the quads overpower the hamstrings, then they pull the front of the pelvis down. We're not talking about inches, we're talking about such a small amount. But what that does is it brings the back of the pelvis up and overstretches the hamstrings. When a muscle is chronically overstretched, it doesn't engage as well as it should. It can't contract like it should. So if you pull the front of the pelvis down and the back of the pelvis is up, then that is going to put a tremendous amount of pressure on all of the tissue the whole way to the bottom of the foot. Because even though you have different muscles, they are so intertwined with fascia, they are so connected and they are one line. So that is where a lot of plantar issues come from. So if you're feeling the bottom of your feet or the heel, then the answer is really roll out the quads, strengthen the hamstrings. So that's something that we're going to cover today. The other problem that I see in runners is that as you run, you tend to lose internal rotation of the hip. So if the head of the femur cannot rotate well in the acetabulum, then it's putting a ton of pressure on the SI joints. If the femur isn't rotating like it should, then the whole pelvis has to rotate. So you can imagine if the whole pelvis is rotating, it puts a lot of pressure here on the SI joints. It puts a tremendous amount of pressure on the vertebrae, the lumbar vertebrae. That means that they have to move more laterally than they were designed to do. They're designed to move a little bit, and that's important. We need to be able to rotate our trunk. But if you are expecting those lumbar vertebrae to compensate for the lack of rotation in the femur, then you're going to wear those facet joints out in your low back. So if you're feeling a lot of pain in your SI joints or in your low lumbar vertebrae, then maybe you don't have the rotation that you need in your femur. So those are the patterns I see most often in runners, and that's what we're going to cover, and that is what I would encourage you to do for a recovery after runs. So what that looks like is rolling out all of the muscles that are inhibiting rotation of the hip and also rolling out overactive quads. Let's start there. I like to use a pair of therapy balls. It's important that they are pliable and a little bit grippy. So you're going to start at the knee, and you want to use as much pressure as you can stand. And you're going to, you know what, I'm going to adjust because I'm going to roll myself right off the camera. So you want as much pressure as you can stand through your quads. And you're going to roll the length of the quad fibers. Get this ball out of the way. You're just going to propel yourself with the elbow. Now this isn't a 30-second exercise. This is going to take some time. It's also important if you come to a spot that's like, ooh, a little bit stingy, contract the muscle. Really grip the ball with the muscle. Hold it for 10 seconds and then release. Another technique that works really well is to change the length of the muscle through which you're putting pressure. Bend and straighten the knee. That will change the length of the quad. And you'll feel, as you are asking more length, you'll feel it, but it really helps to get into deeper layers of tissue, and it helps release those quads that are just holding on. And then continue to do the same thing all the way down the muscle. Now, the muscle that tends to be the tightest in runners is the lateral quad, vastus lateralis, and also TFL. They kind of feed in together. So I like to come, I'm on my side, but I'm more towards the front, right underneath my hip bone. And again, if this is stingy, if it burns a little bit, then take more time there. Grip the ball with the muscle. Really grab onto the muscle, or to the ball with that muscle. Hold it for about 10 or more seconds, and then release it. And then use the pin and stretch technique, where you're lengthening out the muscle, bend and straighten the knee, and you can even do shift left and right and get a little bit of cross fibering. Really work some adaptability into the muscle. And then work down the lateral quad, a little bit of IT band tissue as well, which is just connective tissue. And this can be really tender. If it's tender, take more time. It really works. That tenderness does go away. But if it's really tender, that means you really need this work. And you have all the control. So you can take as much time as you need to work through the tissue. And you're going to come all the way to the knee where those muscles connect. This is a great activity. If you're ever watching television, don't make it a passive experience. Grab your therapy balls and roll these muscles out. I rarely do any meditation without rolling something out as well. I never go in a car trip or on an airplane without some therapy balls through which I roll everything out and use that time instead of just watching something or spending the time in my head. I'm doing therapy on my body. I'm rolling something out. Okay, using the time. Okay, so we've rolled out quads. We've rolled out TFL. We're going to shift now and roll out glute med. Glute med is another one of those muscles that keeps the hip from rotating well. So it's on the other side of TFL. So now I'm on my side towards my back. And I'm going to put all that pressure through glute med. And if it burns or stings, again, that just means you're going to spend more time. Grip the ball with the muscle. Really grab the ball. Hold it. And then release. And you'll find that your nervous system lets the pressure of the ball deeper into the tissue. Also, to do some adduction and abduction, internally and externally rotate the hip. And that is also a great way to build some adaptability into the muscle. Good. Again, you're going to do both sides. And you're going to take all the time you need to make this feel good. It should feel good. Okay. So a great test to see what kind of rotation you have is when you come into a 90-90 position, so that your femur is straight out, your front leg is straight out from the hip and sideways so that your heel lines up with the knee, lines up with the heel of your back leg. That's how you know you're in the right position. And are you way out here or can you sit up straight? Now, this will probably look different side to side. One side will be easier than the other. So the front leg is in external rotation and the back leg is in internal rotation. And you can work on building more control into those muscles. I like to pick the back leg up. Do you have that kind of control with glute med? Can you hold it a little bit parallel to the floor? It's okay if it's shaky. Can you pick up the front leg? Can you work the front leg to the floor? Those are all things to work on in this position. And then, of course, test the other side. Line the front heel up with the back knee and then the back heel. And how does this side feel? Can you sit up straight? Can you work that front knee to the floor? Can you pick up the back leg? And can you pick up the front leg? Really good, good things to work through. In this position, if you have a muscle that just feels a little bit tight, you can also place the balls and work a muscle out, and then come back and see if you're able to sit up straighter, get your legs a little bit more into the rotation they're in. Again, press the legs into the floor. Press the back of the front leg into the floor. Press the inside of the back leg into the floor. And get to the point where they're shaking a little bit. That's where tissue change is made. So pressing, how does that feel? And then releasing. So because runners are quad dominant, it's really important to build the hamstrings. And there's a couple of exercises that I like to do that. You probably have your favorites. So I suggest spending more time with hamstrings than quads in the gym. One exercise doesn't require any equipment. I like this because it's a counter pose to how most people spend their life. It's also a counter pose for running. If you so you're laying flat on your back, you're paying attention to engaging your core so that your ribs are not flaring up. There's no back extension here. Your ribs are on the floor. You're not smashing your low back to the floor. You could slide something, you could slide a piece of paper under your low back, but your ribs are on the floor. Your toes are together, your heels are separated by a few inches, your knees are bent up about 10 inches, and your feet are pulling back toward you, so you're in pretty good dorsiflexion. In this position, your adductors are on and your tibs are on. That's good. We're trying to build our tibs and we're trying to build our adductors. Also in this position, TFL is long, vastus lateralis is long. So it's a really good counter pose for running. Now we can intensify this exercise by pressing the heels into the ground and isometrically, which means they're not moving, pulling them up towards our glutes. Now you could intensify that so that it lifts your hips off the ground 1/4 of an inch or something, but you don't have to. The idea is turn your adductors on, turn your hamstrings on. So isometrically moving your hips and heels together, really working your inner thighs together, your knees together, and pulling back on your tibs. It's a really great running exercise. Okay, then sometimes I'll just take a small Pilates ball. If I have a larger one, I might do both feet at the same time, but it's really good to do one at a time so you really pay attention to the difference between your legs, because they can't compensate for one another when you do them one at a time. So in this exercise, I'm pushing my heel into the ball. My hamstrings are really on, and I'm not letting go of that contraction as I pull the ball up towards my glutes. And I'm just going to do that about 10 times. You have all the control of how hard this could be. This is a good exercise for anyone, no matter how strong your hamstrings are. You're pressing down and also pulling up. Really great, easy hamstring exercise that you can do anywhere. I really like to do it. And then do the other one. Good. So we are strengthening our hamstrings, which will pull the pelvis into more of a neutral position. We're releasing our quads, which allows that to happen as well. We're making sure that we have the rotation in the hips that we need so that we don't compensate movement with the low back or with the whole pelvis and the SI joints. That's going to relieve heel pain as we bring our pelvis into a more neutral position, and it's going to relieve low back pain. So as you're doing this, you're also strengthening calves, and because you're dorsiflexing your toes, you're strengthening your tibs. So this exercise really gets it accomplishes so many goals with one simple exercise. Because we want to strengthen our tibs, we want to strengthen our calves, we want to strengthen our hamstrings. So give those a try and see if some of the aches and pains from running don't go away and you feel a little more balanced.